Hola. Mira, Henry. And then the next day after you were born, you were taken away, and I didn't know why. And I found out after insisting a little bit that something wasn't working right in your body, and you were having like white feces, which is like your movements, your stools were white, so they weren't normal color, light brown for a baby. And they had to start doing tests on you. So they didn't cause too much alarm, but at the same time it was disturbing, because when you just had a baby, you want that baby with you and you don't want them to be taken away, so you know that there's something wrong if they're keeping their baby away. Then one of the doctors who I knew, he was always a good childhood doctor, he said he thought that it might be Alpha-1 antitrypsin deficiency. It's a rare disease. He couldn't really explain it much more, but it was causing the problems with the liver. So your affectation of rare disease was with Alpha-1 was liver, not lung, and it's not usually the lung in the babies. It's lung in the adults. So they took you away, and then after a few days they said they couldn't do more work on the diagnosis because they needed a hepatologist or someone with much more specialist knowledge. And there it was months of tests. You were just a tiny baby. Every time there was a test, you had to wait days, so your body wasn't affected by that test. And finally, after 3 months, we realized that it was cholestasis, which you had, which means the liver wasn't working properly. And they did even surgery and biopsy to check that there wasn't any other issue in addition to Alpha-1 antitrypsin deficiency. And in that biopsy, it clearly showed that you had less, less veins in your liver, and they were blocked by the Alpha-1 antitrypsin protein. So that was causing some of the liver disease. Now, fortunately, with the medication that they gave you, the liver started to work, but it started to work after about 4 months, so we couldn't go home all that period, and we had to just live in more or less in the hospital full time, by some friends who helped us. But I realized that that's a difficult period for parents, because there's all kinds of people around you not knowing what's wrong with their child and fearing for the worst. But at least if we have the information that we need, we can process it better, and we can make steps to try and do the best we can for our kids, and do the best we can to help them learn how to manage their health better, or just confront the challenges of a complex rare disease.
So I wanted to ask you how it was also having me when I was born. How was it as a parent not knowing what your child had, and him being affected and in many diagnoses? And how was it not having that much support, and how long did it take to find out what was going on? What did the doctors say? Did they say that I had a rare disease or Alpha-1? Did they already know I had Alpha-1?
Right. So at that time, the internet was just beginning. So I started to look up and try and find more information about Alpha-1. There was a small association in Spain, which I contacted. And in USA, there was a big foundation which had already started its important work in helping people and families to learn more about the disease and to bring in the specialist. So in Spain, the doctor there, she was ear, nose and throat doctor. She had Alpha-1 lung disease, and she asked me if I wanted to get involved and take on the association, so I did. So I kind of got really in at the deep end quite quickly because I just wanted to learn a lot more about the disease.
Really?
Oops. And the specialists. And find out as much as I could so I could help you. I wonder if when you were a child, or do you have any memories of being different or being affected by Alpha-1? Can you remember anything about that?
So, what I remember and what I kind of understood at that time is that I had a big scar in my stomach, and I didn't really understand what it was or what had happened to me. And sometimes I felt like embarrassed because I had a big scar, or I had a big operation that I didn't know what really was. And yeah, it was tough to be in school, and sometimes, or when you're changing clothes and everything, and you're amongst normal kids that weren't born with a rare disease, and you feel different.
Yeah, I can imagine that. It's sort of something that's difficult to describe, though, until you get to a certain age, because the rare diseases are so complex.
And every examination, every test, and the results was about 3 days that we spent in Madrid, and it was hard for me to stay in a hospital. No, at that young age,
Yeah.
I wanted to play, I wanted to do activities and be with my friends. So yeah, it was hard for me to be in a hospital and having to be controlled and diagnosed, and beginning to understand this was scary, but at the same time I was feeling more of what I
Living.
had and
Your
was
disease.
living. You know?
Yeah. So for young children, it is hard, I think, coming to terms with having a disease, but understanding it too.
Yeah.
And I think sometimes you probably don't understand until you're a younger adult, really. And so it's hard to keep up. Maybe your motivation and who you are, compared to other kids.
Yeah.
I'm not sure how you can overcome that, really. It's just a question of your own mental capacity. That's cool. Great. So I've told you a little bit about my experience. So you as a young dad, obviously Henry has one Z allele inherited. So are you going to do the Alpha test with him? The Alpha
I
family
think
test?
it's important not only for prevention, but to take care of him the best way possible, not only now, but also long term, and see and prevent maybe in the future he could be either liver or lung affected.
Mm-hmm. Yeah. So I know that for young families sometimes it's hard when you have to confront difficult diagnosis, but do you think it's better to know and it's better to be prepared if you're a young parent?
Yeah, I think it's not only gonna help me to see what I have in hands, and also prepare myself in the best way possible to take care of him and see that he has good conditions in his lifestyle and in school and with
The right
the
doctors.
doctors.
That's cool. Well, here we are then, advocating for better diagnosis, early diagnosis, and so we can make better plans and better care for our kids.
What would you pass on to other parents that might go through the same situation?
I think you have to be brave and try and find out as much as possible, even if you're scared. The information you receive might be the worst. I think you owe it to yourselves and you owe it to your child to just do the best you can, because then there are small ways you can help and prevent and look after your child the best way you can. And then you know you've done your best, and that's really important. So you have to put the fear behind you, and you have to... He's going. You have to work as hard as you can to do the best you can as a parent, and that's important.